All right. Well, then, what I want to do is make sure that those words ring in our ears as we turn our attention to. So, what do we do about what we've been talking about all morning? What's the path forward? So, I am going to invite up to the front of the room the folks who know who they are who are part of this next conversation. That you may not know this, but that does include you, Dr. T. It totally does. I said they know who they are, and then I sprang it on Dr. T. So I'm going to introduce them, and then they're going to take it away with a conversation for 20, 25 minutes or so, and then we're going to get back into the sort of the collective discussion. If you want to weave in responses to what Dr. Adams said, that would be great. So here I'm going to just introduce people from that side to this side. So we have Martha Sanchez. She is Director of Health Policy and Advocacy for the Young Invincibles. We have heard from Tyler Norris before. He's next to her. And then we have Saha. I knew that. Saha. I really did it bad. Shoma Saha. Okay. Executive lead for We in the World. That's WE, Wellbeing and Equity in the World. And then last but not least, we have Dr. T. So with that, I think Martha's going to get the ball rolling for us.
Yeah. Okay. Hi, everyone. I'm Martha Sanchez. I'm the Director of Health Policy and Advocacy at Young Invincibles. I'm going to talk a bit about Young Invincibles because I think organization tied into a lot of the themes that I heard throughout today. So we actually got started as a group of college students back when the ACA, the Affordable Care Act, was being drafted. We were the major pushers for making sure that young people could stay on their parents' health insurance plan until the age of 26, a key component of the Affordable Care Act. And when we think about movements, yes, this was 12 years ago, but it happened at a time when it was a slow-growing crisis. It was a crisis that a lot of Americans were dealing with. The uninsured rate was super high, but there was not a pandemic, right? Like, this was a movement that had to be built from the ground up in terms of advocacy and organizing. So our name, Young Invincibles, comes from a play of words that young people are not invincible when it comes to health. We get sick. And I think that 13 years later now, that's still very true. Half of young people ages 18 to 34 self-report a chronic condition. A third of us self-report mental health issues such as depression and anxiety. That's no surprise given the pandemic that we are in a mental health crisis in this country. Recently I saw a report that more and more young people are getting diagnosed with colorectal cancer and at advanced stages too, and doctors don't know why, right? That could have a number of environmental reasons, nutrition, etc. But my point is that, young people, we're not doing that great. We're not healthy. And at Young Invincibles, after the passage of the ACA and our organization was founded, we still focus on healthcare, but we also focus on higher education and workforce opportunities. So a lot of our push has been around paid leave on the workforce side, but also on the student loan forgiveness side. We pushed the president to issue that executive order forgiving student loans. And at first it was forgive all debt, and then we kind of brought it down. Well, we didn't bring it down. They brought it down, but we accept it, right? Like, we will accept any kind of relief along with this very bold idea, because I think at YI we are working along those intersectionalities of health and well-being. And I think that young people are more receptive and more acknowledging of this message that we've talked about throughout the day about well-being. Maybe we're not calling it well-being yet, we're calling it self-care. And it's something that is really intertwining just a lot of young people the way they are expressing today online. So I think when I think about a movement moving forward, it's the fact that young people are in a crisis. Young people are all of the data points that you all are researching. What we need is an investment in our voices so that that person who is in TikTok venting about how she couldn't afford her mental health therapy because it's $60 out of pocket, even with insurance for every session, how do we get her story heard in front of Congress, in front of a legislator? And prior to joining YI, I was on the Hill right when the Inflation Reduction Act passed. And from 5 years of being a health legislative aide there, it was very clear to me that it was always the stories that stuck with me. And Congress, there is such a disconnect between the people and elected officials sometimes, but then you'd be surprised that the people who are making recommendations every day are young people. And it was always the stories where even I could connect with that stuck with me, and that stuck with me when it came to making those policy recommendations. So this is all some food for thought, and we'll continue the discussion on this panel. But my opening point is, when you think of movements, they're usually led by young people. So we must include young people in these conversations, and we must invest in making sure that we are able to amplify our voices.
Couldn't agree more. I'm a little older, but I have a young person in my life that has been part of helping me stay clear. When we began this shift from thinking about healthcare to health, I still remember the beginning of that shift, of the reports coming out, the health and social care graphic, the culture of health being announced, the National Academies and IOM and others. It felt like everybody was moving together. I remember this vivid moment of being in a room, I think it was at RWJF's 40th anniversary, where there were 400 field leaders there of every sector and group that would be needed. And I remember having this visceral moment of realization that everyone with 1 or 2 degrees removed that you needed to actually change the system was there. But none of us were organized or connected or in any kind of place to be able to actually do something about it. And that began for me at the time. I ended up going to IHI. We started 100 Million Lives. That evolved into realizing, actually just as a question of how might we do this, to then hundreds of group organizations actually stepping forward across sectors with solutions that were brilliant. And we saw the power of a network where you could source, with 1,850 partners reaching over 500 million people, a school teacher in Scotland could create a simple solution that would reduce obesity by 50%. An Indigenous woman could create a way of restorative practices to heal intergenerational trauma. And youth in Wyoming could figure out how to take homelessness from a forbidden topic, youth homelessness, to a governor's initiative and reduce youth homelessness by 50%. The Wellbeing in the Nation Network was born out of that recognition that, in fact, the issue wasn't that the solutions weren't there, they were everywhere, but that we needed, as the National Academies identified, opportunity, infrastructure, and narrative for movements to shift. And we became really interested in what does it look like to build the infrastructure for a movement that could get to critical mass. By critical mass, our goal is 250,000 people who are effective at being well-being and equity builders in the next 10 years. That means they don't just have a surface understanding of these issues, but they deeply know how to begin to create change in these ideas. And to do that, we need to be organized. It can't come from any one organization, right? But the idea that we could form a network and be connected as part of a broader ecosystem that's owned by many, but connected in a way that's strategic enough to move the needle, that can map who's where and can divide the work among us, that can invest in our youth and have the ideas of Indigenous women to scale, and can restore the economy while creating reports like the kind that we help write, with Dr. Adams on community health and economic prosperity, that had a role for the business, and a cooperative that's about how businesses, co-written by businesses, for how they might advance the well-being of people, the well-being of places, and racial justice, and could invest in data infrastructure. And then the pandemic happened. And you know what happened with the pandemic? We were so lucky that we had that infrastructure, because we could activate it in real time, seeing that the resources weren't going to the places that needed it, not from the federal level down, in the way that was needed to bring in and invite in the tribal leadership in the country, 10,000 Black artist activists, thousands of barbers and beauty salon owners and community members and public health departments and health systems to be all in this together, so that we didn't have to be alone. We could bring the public back into public health, and we could become part of thinking about what it means to create health and well-being, not separately, but together. And as we did that, we saw that in Eastern North Carolina, youth and Black farmers saw that food insecurity was the issue that was creating insecurity, poor well-being, and they connected vaccine efforts with food efforts. And as they did that, because they had a deeper understanding, they could do that in a way where they could address the underlying policies and systems with their legislators. They grew food in Black-owned farms. They sold the food to hospital systems who gave the food to others. They held vaccine clinics together with expungement clinics that eliminated fees and fines that kept people from being at work. What they all showed us was that if we can stop thinking about these issues as political and start understanding that health is all of our right, it's the love that we have to offer our neighbors and our children, and the honor that we owe to our grandparents, then we can begin to create a new narrative about health and what it means to us. We can reclaim health and well-being as the love that we show one another and the love that we infuse into our systems. You know, an incredible Black artist activist, Abini Bloodworth at Chromatic Black. Remember, we began a conversation about vaccinations together, and she was just terrified about what it would mean to accept and support a vaccination that, as far as she knew, could be dangerous. Instead of mistrusting her, we said, why don't we trust you to think about what it would look like? Because she cared deeply about her community. And so she worked with her community members to think about what that needed to look like and be. And what came out was a campaign called Keep Black Love Alive. If we can begin to reframe health into things like keeping Black love alive, into more fundamental human terms, even as we organize ourselves in ways that are really important around things like data and moving the money and using our operating dollars as healthcare systems and our investment dollars in a way that's restorative, that recognizes that this is a moment where we can greenline what was redlined. If we just choose to make that choice, we can frame ourselves not as the people who are extractive profiteers over people who are in their poorest moments and their most ill moments of life, but who we were to be in the first place as all of us went into healthcare, which is to be restorers of love and community, not just one person at a time, but each system at a time. Thank you.
Good? restorers of love. What a beautiful place to be bringing us. I'm Tyler Norris, and I'm having a beautiful thought of rolling back the clock 30-some years ago, where I started with this work as a relatively young person. When I got to receive the first grant from the Office of Disease Prevention and Health Promotion, Michael McGuinness, to help bring the European Healthy Cities model to the US, which became the birth of the Healthy Communities approach. And I called it Healthy Communities because it wasn't just cities and it wasn't just about elected leaders. It was about this faith in people, faith in young people, older people, the wisdom of community, the love of community, to be able to actually get work done. That love underlay trust, respect each other, respect, like, look again, respect. We see each other in a different way, and we can begin to see where we started off this morning so beautifully, Ray, with yours and others' comments, that we have all we need. We're blessed with abundance. And that doesn't mean there's not places of misallocation at times, but that we're blessed. And communities know how to do stone soup. They know how to find what is needed to get work done. And they also match another piece that was said, which is that we actually increasingly know what works, not only at that grassroots community level, but that the evidence base, through institutions like this one, have helped codify what we know actually works and then can be adapted and applied at the local level. The community work, as it started to grow from 10 communities to 50 communities to, over time, hundreds of communities, and they all took different names, healthy communities, sort of shifting as language and became so many other things, placemaking and so forth, was that if you brought a thoughtful group of people together, a diverse and thoughtful group of people together, and gave them space to articulate their values, what do we care about? What matters to us? And then they would create visions of the future rooted in those values, right? That's what a vision is values manifest. Story of our values, what we care about, manifest as outcomes for our schools, that these communities, given that kind of opportunity, would, Ricky do that work every day right now, they would not only get things done, they would only kind of create common agreement, but they would get things done. And they would put themselves on the line for it because they were in the kitchen to start with. And that premise that was at the base of the Healthy Cities, Healthy Communities movement 35 some years ago, that built on model cities, is still playing itself out in lots of different names, and I won't go through all the sub-movements. But what I want to recognize is that it was a distributed, and is a distributed movement that both has distributed action that people are taking in their organizations through practice changes, together through public policy changes, and often collaboratively through investments, but both where they stand and also collaboratively. That fractal stays alive also when we think nationally. So as a community builder, having gotten to be in every state in this country over the years, and I found myself increasingly having the chance to work, like Active Living by Design, given an opportunity to help chair that initiative, the Robert Johnson Foundation, Healthy Food Finance Initiative, eventually doing work at Kaiser Permanente, in how do you actually bring these principles of community-level movement building to scale. And one of the things we learned, and we learned it really strong, I think, in our Kaiser Permanente experience, is that it's got to be all in, with the same kind of all in that's real among us in our community, because there's no place else to really go. And so, yes, we had to have our community benefits spend focused on well-informed priorities, connected with the community, actually flipping the power equation, as the California Endowment and others have think about centering really in power, but ensuring that our investments have enough reach, intensity, and duration to have a population-level impact. In other words, enough dose. and that most of the kind of grant making we were doing was directionally correct, and you could see anecdotal evidence, but it wasn't having that population level work because it lacked sufficient dose. So we started doing things longer and stronger and more intense and with deeper partnership, deeper power in the community so that we could have an impact. And then recognize, particularly as health systems, as anchor institutions, that whatever the community benefit budget was, and however much of it was spent on charity care coverage versus in grant making, that the purchasing power dwarfed, sometimes 10x, the grant making. The payroll of hiring from the communities that we were serving, and that use of the investment portfolio, large or small, and most nonprofit health systems have a tidy sum on Wall Street right now, which we view as trapped assets. How does that become deployed? And I'll never forget the day, and I'll invoke a dear friend that many of you know, Maureen Bisignano, said, and a number of us were together, when you know that what you're doing doesn't add up, right? Not sufficient dose, not anchored, not connected in the community. When you know that what you're doing doesn't add up, it is unethical to continue doing it that way. Mm-hmm. So we have a knowledge base and the assets in this country and an understanding of how things get done. This is what Alexis de Tocqueville wrote home about in 1834, is these Americans, they just get together, it's more erudite, but they get together, have the meetings, have the fallout, and then they decide things, and then they just go and do them without asking anyone's permission. That is our greatest asset. So deliberately, and maybe 2 minutes, or am I passing welcome?
Dr. T.
Yeah.
Dr. T next.
Yeah, but I've already spoken, so
Okay, I'll just say this, because I'll try and bring it to the national. So when I got a chance to help start Wellbeing Trust 6 years ago, we were asked by the sisters to build a social movement around mental health and well-being. First was, the language, build something, there's already so much going on. Asset-based would be, so how did we start with that? But we did do something very thoughtful around movement building, which is what really are the nature of social movements. And I already talked about the distributed and the collective parts. So that whatever we do, we want to think about maybe a handful of things that we do together, 1, 2, 3 of them, and then how are we supporting people and leading from where they stand? So there's really both properties. But we reverse engineered social movements starting with abolition, and then suffrage, and then civil rights and environment movement, all the way to marriage equality. And we identified from that about 7 kind of patterns that were always present. And then there's a nice threesome here in the Academies that will kind of get that even more simple. But we noticed they were always present. So, for example, the first of those was a policy apparatus. It always was strong policy. We asset mapped the mental health movement in the U.S. and found there was no strong 501c4 doing that work. Take the gloves off. So we built Inseparable, a 501c4 to do that, to help build out a key part of a movement ecosystem. Now in communities, you get that. The policy, the communications, the data, the proof points, all of that shows up in the room, but it's a little harder at this level. We said, where's the communications and the leadership with youth? And we said, well, actually, Young Invincibles. This is before your time. But then we turned around and invested in Young Invincibles and others because we didn't need to build something there. It was building on the assets. Where was the philanthropy to bring more high net worth people in and to even get past the stigma, to even talk about what was going on in their families, let alone to be able to give? Nothing. We built mindful philanthropy to be able to do that, to bring more resources together and invested in the evidence base of what works. And I won't go around this. We partner with the Kaiser Family Foundation on granular level data. We helped build the CEO Alliance, which now connects the leading mental health groups, the APAs, and I've never talked to each other. I mean, friendships, but never really worked together. So my point is here is that we know what works increasingly. If we behave like communities and we have the assets and we actually understand what the signs of movements are and how to very deliberately invest in them as an ecosystem. And so whether we're in the fractal of a community on the ground trying to increase access to healthy, fresh foods and recognizing the co-benefits to health, to the local economy, to returning incarcerated, working in those, you start to see these co-benefit multi-solvers. That's what we get to do in this room. Just like we try to do with Wellbeing Trust at a national level. You've got to build that, really asset map what's there, identify the gaps, build on the assets, and find those couple things that we should do collectively. So one of my hopes and inquiry here is that we really root ourselves in all that's here and say, what is it that we could and collectively do to move this forward in a disproportionately powerful way? So that's my curiosity for where we continue to go, and it's rooted in the pragmatism and realness of our youth and the rawness of our communities that are heartbroken open, like my home of Oakland. So, there. To T.
Well, I guess I'll round this out here. I love that. Just a couple points really to add to what you all said. I thought this was so inspiring. I could have just listened and actually not had much to say, but I'll try to add a few things. The first thing I want to add, I want to have a friendly amendment, Tyler, to what you just said as the sort of ingredients, even before the sort of asset mapping, and it's increasingly important, especially in the political context in which we are operating right now, and that is an understanding of history and context. Because oftentimes we map the existing of what existed, but not how we got to what exists today. And I think that kind of activity can lead to, if we're open to it, sort of truth and reconciliation about how we actually got here. So I think about especially issues of race, not just race, but around a whole series of issues where we have undermined the success of folks. And then we find ourselves in a situation where there are disparities, right? We talked about that in one of our sessions today. And then we say, oh my gosh, we have to do something about that. Well, it's not just something about that. We've done something about that in the past. That's how we got to this situation. And I think without that kind of remembering, we don't have a full appreciation and an understanding of the trauma in which people are coming to the table and sitting with us trying to figure out problems. And so we don't even understand the tensions that are in the room as we're asset mapping. Like, you want to asset map what's in my community or that community, but we haven't had a discussion about the fact that how we got here, right, was a strategic disinvestment in people in my community. And I'm mad about that. And I'm enraged about that. But I have to sit here and have a polite conversation about, right, what we're going to do next, right? So I think I love what you said, and I would add to that a real thoughtful understanding of history. And I think when we get to the point where we are lovingly, thoughtfully, right, to use your language earlier, facing that history together, there's a kind of healing and understanding that gets us in a different place even before we start the work. And that has to be centered. That's a part of that trust walk. Like, I don't trust you if we're not on the same page about what happened in the past and how we got here. And I'm not always sure that folks really understand how important that is, especially to marginalized folks. That just one part of the activity like sends us in a whole different direction than it would have otherwise. I want to recount an example, and Steve was, I think, in the room when we had this, an example from one of our colleagues who does a lot of work in maternal health, and he's a physician, and he was trying to, the hospital had him trying to figure out how to address the fact that maternal health was a challenge, especially how many women were dying in childbirth, especially from communities of color. And as a white physician, he wanted to help. He designed a whole program. He was trying to figure this out. So he started by asking a lot of the moms in a particular community expectant moms to come to a program that he had designed about how to get ready for birth and the kind of things you need to think about in a very thoughtful way. And he'd done this, sort of rolled this out several. I think you were in the room too. And he recounted the story of the first couple times he gave this, he literally got tomatoes thrown in his face, because when he started to talk about this work, people would say, the women in the room would go, I don't trust you. Every time I've shown up at that hospital, I get treated like nothing, right? And so you want to come here and pretend as if you really care about me, which I know you don't. The only thing you care about is whether I have a healthcare card that says I deserve at least a modicum of respect because somebody can pay for my healthcare. And he was shocked by that, because he kept trying to say, yeah, but I'm really here to help. And what he had to recognize over time was there was just no trust in the room. And so we sort of worked with him on the case-making part of his conversation. And we talked about that. We said, right, put the papers down, right? Put the presentation down and have a real conversation. A conversation, and he ultimately did, that started like this. I'm here because your baby is the most important baby in the world. And I want to make sure that you get treated like that. Beginning of the conversation. That changes a whole lot of stuff. Not here's what you need to do, not here's the hospital policy on that, not here's the phone number of the, just real to real, right? Changes the tenor of that conversation. And so as we're thinking about the work that we do today, again, that's a part of that trust walk. What does that look like? So that's one part of it. The second part, and I guess I'll be brief because I know I see James moving over, which tells us that it's almost time to close and move on. I just really want to echo, I think, what the panel has said and what many of folks who've spoken today, even Dave earlier, really have said. And I want to just make sure it's super crystallized in the room, but just connecting to the aspirations of the people that we're talking to and how important that is. Like, that is really, if you want to pull young folks forward, you got to talk to young people in the language they get, in the language that they have, in the technologies that they have, in the spaces where they're sitting, not where you're sitting. I might say that, it's not about us in this room, it's about who we're talking to, whether that's young folks or legislators or folks from around the world who are trying to improve health, or folks who are concerned with mental health, whatever that is. Get out of your own self and into the mindset of the person you're talking to. And what is it that they care about so much that when you say that to them, right, there is a shared, not just value system, but an aspiration that gets connected. Dave, when you mentioned this morning, you talked about talking to folks in terms of not just lives or years gained, but talking to folks about the number of birthdays you get to experience with your loved one because we're doing this work. Wow, like every person in the room could think of somebody that they cared about so much that if they could just have a couple more years, minutes, seconds with that person, it would make all the difference. And when you connect to folks in that way, my God, you don't have to convince them with return on investment numbers, right? You just said everything you needed to say. They'll ask you next, how can I help? What time is the meeting? What do we have to do? That's the connective tissue. And I think in many ways, all of us have been saying that, right? Nita early, all of us have been saying that. And I just feel like I want to make sure it's so crystal clear when we leave here that that's a part of that initial conversation.
Woo! Yeah. So thank you to all of you. We're actually going to spend some more time with this group in various formats throughout the rest of the afternoon. Well, they're going to be done for this afternoon, but throughout tomorrow morning. And in order to prepare ourselves for that, what we want to do is make sure that we're thinking about what we're thinking about. So we are asking you, you're going to turn to small groups. You can stay in the same. You can readjust if you want. And if you haven't introduced yourself yet, do so. What are the promising ideas that you are contemplating? And we want you to be specific, like get into the who, what, why for your own context. Like, we want you to start thinking about what are the kinds of ideas, given the conversations we've been having, the challenges we face, like that have been placed on the table for us to think about. What sorts of things are you thinking about taking home? We want to start talking about it today, and tomorrow we're going to really spend the morning honing those things and making sure you're able to go home both with an idea and then what to do about it. I do want to remind us about the information about movements, about opportunity, about messaging, about infrastructure. So as you're thinking about your idea, or ideas that you're contemplating, like think about what does that mean in terms of what are the opportunities that exist at home or with the group that you work with? What's the messaging that needs to connect with the people that you're actually dealing with? What's the infrastructure that either is there already that you can connect with and or that needs to be organized differently in order to be able to make progress? Like, let's start thinking about what we may be able to do with these great conversations we've been having so far. So I'm going to ask you to have those conversations until about 4:10. So Fisher's going to send folks into small groups online. Again, you all can get yourself into groups of, I know, it's really exciting over here. So like until 4:10, and then we're going to check in with the group, and then we're going to prep ourselves for what we're going to do tomorrow morning. Is the task clear? Yeah? All right, go for it. So Fisher is going to pull up to the screen behind us the Jamboard, a place online where people have been capturing thoughts and ideas. We're just going to let that get up there. As he's doing that, we would love either online. So if you can hear me online, we're talking to you. We would love if you want to come off Zoom or come off mute and share an observation or question. Online folks, we'd love to have you. In the room, if you'd like to come off mute and share an observation or thought, we'd love to have you. What questions or observations came up in your small groups that would be helpful for us to contemplate as we wrap up today? So what questions or observations came up in your small group conversations that you thought would be helpful for us to contemplate today? And then we're going to turn our attention to the Jamboard. Is there anybody who wants to? Okay, I'm going to start with the Jamboard. So, I don't know if you can see some of these: intersectionality and holistic approach. There's an article of incorporation up here. What does that say?
So there was at least a little bit of conversation at one point online about aging and older adult health, and just wanting to bring attention to that as part of the conversation as today as well. Just that. So that was just an example of one activity that's happening related to older adult health and to aging.
Interior Community Aging Network. There it is. Okay. We need to work to reduce the assumptions and narratives that impede our ability to provide direct cash assistance to families. Right. How about in the room? Observations, questions? Yeah, Rick.
Well, where Hillary and Terry and I just left off was, I think this is a good something to capture going into tomorrow, is that there are actually thousands and thousands of communities who are actually leading the way in terms of finding ways to come together, telling the truth, walking that truth walk together. And we can learn an awful lot from them. But the good news is that there are so many of them. I mean, here in this room, we probably have more like what we would call the intermediary leaders, like Wellville and Invest Health and WIN Network. But it's the communities. In fact, we heard from one in the walk in the other room in Washington. So anyway, I think that's something that we can take into tomorrow, is the faith in that communities are finding their way forward and we can learn from and with them. And then the second is, Hillary asked a question, which is, so then what is sort of the minimal level of infrastructure, kind of infrastructure in quotes, that's needed to spread and scale what these communities are doing to the national level?
That's great. Thanks.
So we talked about a lot of things, and I'm not going to do justice to it. But, we talked a lot about, are we dancing around a lot of the issues, which I think we've been doing for hundreds of years. We're dancing around issues and not getting at root causes. So the truth walk is really important, but also acknowledging that the truth walk is really hard depending upon where you are, and how you have it and who's the messenger. I think that, and people have already mentioned her numerous times, Heather McGee, and this concept of the solidarity dividend. the book was so profound, and it's laying the steps, right? We have to take the steps, and then as we take those steps, more steps will, I think, reveal themselves. But how do we operationalize the solidarity dividend in our narrative, in our organizing, in the way that we show up in these spaces? But to get more concrete and just to build upon what you just said, and you've heard our story from Washington. Even in Washington, we have proximity to power, right? I'm a senior director in an agency. We get invited to stuff like this all the time. We bring our steering committee members with us whenever we can. But even our leaders, and I have a lot of influence, I have some power, but then there's, as you were saying, there's the people who are making the decisions, the people who ultimately the votes depend on. And a lot of leaders who don't think, they're happy to let us do this work and to have the hard conversations, but they themselves don't think necessarily that they have the time to listen to our steering committee members. Sometimes they don't have the time to listen to me. And I would argue that every leader, if you're in a decision-making capacity, should make the time to listen to the people that you profess to care about, because that's what ultimately in our circle is starting to change the minds of leadership and bring people who are experiencing the issues, if you're authentically engaging with them, bring them into every single space that you occupy.
So we do a lot of work in our work about equity and integrating equitable practices and integrating equity into strategy and into culture. And one of the things that we know is that the ability to direct the use of time is a function of power. And so even like people who say, I don't have the time, sometimes that's because other people are directing their time in a way that they cannot. And other times we're making priority choices. And one of the things that's really fascinating is how often people who have the ability to direct time believe that they have less ability to direct that time than they really do. How often people are actually making choices that they believe are being imposed upon them. Really what they're doing is that they're prioritizing. That is true up and down the economic, socioeconomic scale. Like that is not simply about people who have a lot of letters behind their name and or a lot of people that report to them. It's true in lots of ways. And it's one of the challenges for doing any of this work well is, right? Time is money. Time is power. A lot of people, though, really want to think about it if we start talking about well-being. Time is life. Time is love. Right? It's a different view of what time actually is. And what is it there for? What do we do with it? Other observations and questions? Y'all just want to go home? Okay, we can. I'm not going to keep you here longer than you need to be, so make sure it's on.
Terry Williams with Advocate. So one of the thoughts that come up several times today, but we haven't used these explicit words, so I thought I would highlight it, and that is, what is the expectation management or the expectation process on a journey that we know is complicated? And we've probably all been a part of efforts where certain folks will disengage because that was a spicy conversation and they disengage. Whereas had they realized we need to have several spicy conversations in the first, or we actually don't have a firm footing on which to go. And at least I've, especially as we've some multi-sectoral partners we've gotten with, and I'm playing off the executive comment a minute ago, before they walk in the room, they need to be anticipating that, because instead of interpreting that as in the corporate world of that doesn't seem
under control, right? Which is a filter they would use in the corporate world. Actually, it's about to be a different kind of experience, and that's the way it should be. And so it's in this theme of expectation management. To me, it's a small piece of infrastructure to me or a capability that goes with this journey. Otherwise, some of the very people we need to stay committed at the table will disengage, and you can't get them back sometimes for a year or two. But they had poor expectations.
That's great. Was that were you raising your hand? I see Dave was. You were too?
Very brief comment.
All right, then we'll go to Dave.
As an advocate, I've never seen anything work better to change a member of Congress's perspective on something than seeing it firsthand. They visit something and they see it in real life. They touch it, feel it, smell it, have conversations, and those, to this point of stories earlier, stay with people to change policy, but only if it's different than what they expected to see. So I just kind of echoing that point. It's got to be a surprise, and then it's meaningful.
Thank you so much. This has been such an incredible day, and I've learned so much from each of you. I just wanted to share a couple of thoughts about money and power here at the end of the day. And I guess my starting point is that thought that I tried to articulate this morning about how I don't want to come back here in 10 years and have, a version of this conversation again where not enough has changed, or, God forbid, things are even worse than they are today. And so that's really the spirit that, I'm thinking about these two things. The first is that we've talked a little bit about profiteering and greed, and the ways in which that is cannibalizing, a lot of the things that we care about investing in. But I think that it warrants even more direct conversation, but also that it's a power center in the sense that the way that conversation is entering into the public dialogue. Many of you may have seen the media stories, for example, in the New York Times about nonprofit hospitals as one example. But I think much more powerfully, just the ways in which this is being felt by our neighbors, our community members, our family members, with respect to the burden of medical debt, and what that means for the ability of people and families to make ends meet. So I see that as, yes, of course, a problem, but also a power center for us to tap into that is very broad-based and that seems to be ushering in, a moment for change. So that's the first one. The second one is around movement building. And, again, I've really appreciated the humility with which so many people have talked about how this movement needs to be built. One area that I wanted to add to the conversation is that in rooms just like this, in many other sectors, people are having similar conversations. And I'll just name a couple of them as examples, but frankly, I don't know about half of them, so probably others know better. But in philanthropy, it goes under the label beyond neoliberalism, as some of you may have heard. In the economics profession, people are talking about a moral economy or a human rights economy. And in the legal profession, there's law and political economy. And I think all of them tap into the very same things that we're talking about with respect to money and power.
So I know that there are other people who have observations and things that they want to share. I know that because at least one of them raised their hand, and I waved them off and said we don't have time to do that today. So come back tomorrow, right? Like, we are going to spend more time tomorrow. What we're asking you to do overnight is to noodle, is to contemplate, is to cogitate. Somebody want to help me with some other synonyms? I want you to be thinking about what is an idea or two that you're interested in getting clearer on to be able to take back to your context. Because tomorrow we want to be talking about honing the idea and also the steps that can be taken in order to operationalize those things back wherever you want to do that. So be thinking about, like, let's move into, so what is this going to mean for me? What could I do differently, potentially, and with whom? And then again, we're going to spend our time tomorrow thinking through how do we get clear about those things and how might we move those things forward. So that's what we're going to do. Breakfast, they're saying you can arrive, by 8. Food will be here, probably a little bit earlier than that. We're going to get started promptly at 8:30. We like to end our meetings, though, a very specific way, and that is by sharing one word or short phrase that describes something you're taking away from our time together today. So one word, Anita, just so you know, you're going to be first. One word or short phrase that describes something we're taking away from our time together today. So something you're taking away from our time together. We're just going to pass the mic through the room. We're asking the folks that are online to drop your one word or short phrase in chat. It'll get back to me, and then we will end our time. So, task clear? One word or short phrase? Yeah? Okay.
Shared values and radical change.
One word or short phrase. We're good. You did good. No, you did good. No, you did good. That's a short phrase.
Okay. Acknowledging my truth and that I exist.
Actually going bolder.
Impressed.
Shame that we let things get to this point.
Investments.
Movement.
Investing in change now and over the long term.
Taking what we learn and scaling what works.
Intrigued. ...
Learning more about health policy.
Committed.
Let's think bigger.
Courage and trustworthiness.
Dismantling and reimagining.
Trot. Donna, you trot. Okay, I got it.
Thinking outside the box.
A new social contract.
Changing the narrative.
Determined.
Confronting policy with experience.
Compelling narrative.
Moving forward together.
Active action network.
Trust walk.
Radical incrementalism.
Grateful and determined.
We best be using this moment.
I'm going to say getting to the real. All right, it is 4:29. You got a whole minute left to do it whatever you want. So with that, make sure you come back tomorrow where we will continue the conversation. Thanks so much for being here today.